If you've ever gone down to the lab to get blood work done, you've met a phlebotomist. A phlebotomist is an individual who draws your blood, whether it's through an IV, a blood drawing needle, or even just a finger prick. It is something that is very easy to do, but if you're not knowledgeable with it, it can be very detrimental to the individual that is having the procedure done and can cause injury. With this being said, that your phlebotomist does not always have to be certified, but there are credentialing agencies out there that are able to provide credentials for your phlebotomist. One of the big ones that I've gone through is ASCP, American Society for Clinical Pathology. With that being said, I have been doing phlebotomy for 9 years now. Now, when you come in for your procedure, our job is to make it as easy as we possibly can. You're going to have people that have veins that are no problem to take care of, and then you're going to have ones that you're going to spend 20 minutes trying to find before you even draw their blood. Now with this, once we get the patient situated, we get all their information that's needed, we have them verified, that all the labs that they're having done to make sure that nothing is being missed. With the next step after that is we start prepping our equipment. That's going to be prepping the tubing, or the blood tubes, the needles that we're going to be using. So the tubes, it's going to be something as simple as this, to setting up our needles like a butterfly or a straight needle. Each one is going to have its pros and cons. Depending on the patient and the amount of tubes, I personally like using the straight needle. The straight needle is very easy. It's one shot and you're able to pull everything straight from there. If you're going to have a patient that needs multiple blood tubes, in my case it's normally 4 or more, or if they are a hard stick, that it's normally a hard time for a phlebotomist or anybody to draw their blood. That's when we would go to the butterfly. Now, unfortunately, I don't have any patients or personnel that I can show how to do this on, but we can make do by showing. So what we would do is we would take the cap off. You have, for the butterfly, this button right here is the safety mechanism. It'll shoot it right into the device. So you would come up, you would clean the patient's arm, you would make sure the tourniquet's on, find your vein. After you clean it and you select it on where you're going, you will then take their arm, you will anchor their vein, and you will take your needle and you will slide it right into the vein. The nice thing with the butterflies is, with it being a clear tube, as soon as you get into the vein, you will see it. You will see the blood start flowing into the tube. You will then take your tube, put it right on in, and it will start flowing up with blood. From there, you will take it out and switch to another one as a finish. Once you are finished with that, you will then take the needle out, place the gauze where the needle is at, and in this instance, you'll press the button to retract it, and so you don't cause any unintended sticks. You're not sticking yourself, you're not providing any extra sticks to your patient. From there, you would take the labels that are printed out or handwritten for each specimen, and you will label all the tubes right in front of the patient. From there, the patient, seeing that everything is labeled, they are finished. They are hopefully satisfied that you provided everything in a good, positive way. And if there's anything else that can be done, you will help them or assist them any way possible. The nice thing with phlebotomy is you get to see multiple people throughout the day, or you get to see very few and those that are very consistent with you that you get to know on a daily basis. Each day is a little different, and each day tends to be a new challenge. So, when you're talking with your phlebotomist, enjoy the conversation and let them know if you have any problems. Until then, enjoy the experience.